Chemotherapy. Yeah, it's a word that carries a lot of weight, doesn't it? But what is it really? Today, we're going to take a guided tour to really understand one of modern medicine's most powerful and often misunderstood tools. We'll look at how it works, why it works, and the real challenges that come with it.
And that leads us to this really central question, the one that gets right to the heart of the matter. How can something that's essentially a poison also be a medicine? You know, that paradox is the absolute key to understanding the entire strategy behind chemotherapy.
Okay, so here's the game plan. We'll start with a basic idea, the 10,000-foot view. Then we'll dive into how these drugs actually do their job. We'll explore a few of the major types, get a handle on the side effects, see how doctors manage them, and then wrap it all up with the big takeaway.
All right, first things first. What is the fundamental idea behind chemotherapy?
At its heart, chemotherapy is what we call a systemic treatment, meaning it works throughout your whole body. And its strategy is, honestly, simple but brilliant. It's designed to go after the one thing that makes cancer, well, cancer. It's crazy, out-of-control, rapid growth. The whole goal is to unleash these powerful drugs that are especially toxic to any cell that's dividing really, really fast.
So, how do these drugs actually pull this off? Now here's something super important to get. Chemo isn't just one drug. No way. It's a whole category of drugs, and each one has its own specific battle plan for taking on cancer cells.
And to really get a grip on these different battle plans, you gotta know this term, mechanism of action, or MOC for short. Just think of it as the drug's playbook. It tells you exactly how a specific drug gets inside a cancer cell and just messes up its whole operation.
So, this whole process of a cell dividing, that's the battlefield. This is where chemo drugs strike. And different drugs are designed to attack different stages of this cycle. Some of them jump in and interfere with copying the DNA, while others might wait until the very end and stop the cell from physically splitting into two. Okay, let's zoom in and get a little more specific. We're going to look at a couple of the major classes of these drugs to see these different mechanisms in action, to see how this all works in the real world. First up, we have alkylating agents, and a great way to think of these guys as the DNA jammers. Their whole mission is to create total chaos in the cancer cell's instruction manual. So their mechanism of action, their playbook, is to get in there and directly damage the cell's DNA. They create breaks and basically tie it up in knots so it can't be copied correctly. So when the cell tries to divide, it just can't. It fails and it dies. You can see they're used for a whole range of cancers, but this damage isn't perfectly targeted, which, of course, leads to those side effects that then have to be carefully managed with other drugs. All right, next up, we have a completely different approach. Meet the anti-metabolites. If the last ones were jammers, these guys are the imposters. They use deception, a kind of biological sabotage, to shut the cell down from the inside.
Yeah, their mechanism of action is actually pretty sneaky. They're designed to look exactly like the normal, healthy building blocks a cell needs to make new DNA. So the cancer cell, in its rush to grow, accidentally grabs these imposters and pulls them into the production line. Well, these fake parts gum up the whole works, and cell division just grinds to a halt. And because they're messing with the basic process of making new cells, they also affect healthy tissues that are always rebuilding, like the lining of your mouth and gut. And that's why they can cause different side effects, like mouth sores and diarrhea.
So you're probably starting to see a pattern here, right? All these powerful methods, they have a downside. And that brings us to the tough part, collateral damage.
And this right here, this brings us full circle to that question we asked at the very beginning. How can a poison also be a medicine? Well, the answer is right here, in the collateral damage. Chemotherapy is a blunt instrument. It's programmed to kill fast-growing cells, period. The problem is it can't tell the difference between a cancer cell and a healthy, fast-growing hair follicle cell, or the cells lining our mouths and digestive systems, or the bone marrow that's constantly churning out our new blood cells. It attacks them all, and that's what causes the side effects we're all so familiar with.
But, and this is a huge but, the story absolutely does not end there. Because once you understand why the side effects happen, medical teams can get ahead of them. They can anticipate and manage them. And this is an absolutely critical part of the patient's journey, managing the treatment itself. Modern cancer care is just as much about supporting the person as it is about fighting the cancer. There's a whole toolkit of supportive care. We've got powerful anti-nausea drugs called antiemetics. There are things called growth factors that can help bone marrow recover faster and pump out more white blood cells. It's all about being proactive, about doing everything possible to maintain the patient's strength and quality of life through what is a really, really difficult process.
Okay, let's pull all of this together. What's the big takeaway on chemotherapy? What should you really walk away with?
So, if you remember anything from our tour today, let it be these 4 things. First, chemo's entire strategy is built on attacking rapid cell division. Second, that term, mechanism of action, is the key to understanding how each different drug actually works. Third, the side effects aren't random. They're the direct result of collateral damage to our own healthy, fast-growing cells. And finally, managing those side effects isn't an afterthought. It's a fundamental, crucial part of the therapy itself.
And all of this leaves us with a really interesting question for the future. Look, chemotherapy can feel like a blunt instrument, especially now in an age of super precise targeted therapies. But it is still one of the most effective tools we have in the fight against cancer. So the real question becomes, what's the future for these powerful agents? How will they fit in? Maybe we'll see them in new combinations, or at lower doses, or working alongside brand new treatments, continuing to be a vital part of the fight.